Renal colic is sudden, severe pain in the flank, and it is one of the most common urologic emergency. And the cause of this pain is passage of small stones from the kidney to the bladder. This kind of pain is very sudden in onset. It radiates to the groin, and the patient is not comfortable, usually rolling movement in his bed, and sometimes associated with nausea and vomiting. Investigation is classified to laboratory investigations and radiological investigations. Laboratory investigations is urine analysis, urine culture and sensitivity, and sometimes serum creatinine to determine what is the renal function at this time. The radiological investigation is ultrasound for kidneys, for ureters, for bladders, and X-ray also for kidneys, ureters, and bladder, and computerized tomography to detect any radiolucent stones we cannot detect by the ultrasound or by the X-ray. The most important is the pain relief by using analgesics. Analgesics could be used intravenous, intramuscular, or even by oral route. And also watchful waiting for this pain, if it will be recur again or not, and if the patient have stones or it will pass, especially the stones less than 5 millimeters. First of all is the persistent renal colic not responding to painkillers. Second one is deterioration of the renal function, so kidneys coming worse and worse, so this is an urgent indication to relieve any obstruction. Third one is obstruction not improved for 1 month, although we give medicine and we follow up our patients. Finally, sometimes we have like patients with special jobs like pilots or politicians or people who have like sensitive jobs. We cannot leave this person with pain all the time without intervention. Usually the surgery we use for stones, which is the cause of the renal colic, we use like extracorporeal shockwave lithotripsy. What is extracorporeal shockwave lithotripsy? It is just waves coming from outside the body, focused on the stones, and it causes like fragmentation for the stones, which comes out with the urine of the patient. Second one, if it is not responding to this method or modality of treatment, we can use endoscopes. Endoscopes according to the size of the stone and the size of the stone. So endoscopes can be used from down through the urethra, ureter, or bladder, or we can use through a small puncture from the flank directly to the kidney. Definitive surgery depends on the size of the stone and the size of the stone. So we can use the extracorporeal shockwave lithotripsy, which is ultrasonic or electromagnetic waves which come from outside the body to direct it to the stone, which it causes fragmentations and it comes out with the urine. The second thing is we use is the endoscopes, which is easy method for fragmentation of the stones and outpatient procedure. So we can use it from down through the urethra or bladder or through the ureter, and we can use it like direct puncture from the side of the patient flank, his flank, direct to the kidney to fragment the stone and to remove it.